librarian at the Snow Isle Granite Falls Library. Standing here beside me is Karen Vance, and she serves as the other co-head of this grant and the assistant superintendent of the Granite Falls School District. We appreciate our families' active participation in our community needs assessment, and we look forward to hearing their voices through the presentation of the survey data this evening. This evening, we welcome a number of families to this presentation. We acknowledge the members of our early, is that still my part? Okay, it is still my part. Hello, I'm still speaking to you. We acknowledge the members of our early learning team in moving this important work forward. The Granite Falls Community Coalition, In His Steps Preschool, Billy's Busy Kids, Granite Falls School District, Snow Isle Libraries, Snohomish County Early Head Start, and Young Lives. We appreciate the support of the City of Granite Falls, members of our local Chamber of Commerce, such as IGA, and many of our other local organizations, including the Granite Falls Food Bank and Volunteers of America. We are also very grateful to the number of community organizations and individuals that helped with conducting the needs assessment through distribution of surveys and by serving as survey ambassadors.
We were very fortunate to receive grant awards and expert support from the following organizations: the Washington State Department of Commerce, the Seattle Foundation, the Washington State Department of Children, Youth, and Families, and the Office of the Superintendent of Public Instruction. And while we appreciate all of you in the audience being with us, we also would like to recognize several leaders of this work who are here in person. We have with us Ms. Mary Taylor of the Department of Children, Youth, and Families. We also would like to acknowledge one of the Granite Falls School District board members, Dr. Richard Panegas, and the Granite Falls School District Board of Directors has placed early learning as one of our strategic goals for our district and community. And then Mrs. Carol Panegas is president of the Community Coalition. We appreciate your leadership and your presence. Our families participated in several languages, and we are so thankful that all the extra efforts to just make sure that you could share your voice were really taken and put into place. If you have questions during this presentation as you're listening to the voices of our families, webinar participants will be able to enter those into the private chat box. There will also be a time for in-person participants to ask questions. And then Jana and I have provided our contact information in the past, and we'll be following up with a thank you as well, so that we're able to answer any additional questions. As we transition to this exciting next step of hearing from our families' voices, we'd like to start by saying we were indeed fortunate to employ the services of a stellar team of researchers in conducting our community needs assessment. And they employed the highest levels of expertise, confidentiality, and skills. Washington School Research Associates has conducted similar work for multiple public and private school districts, universities, the Office of the Superintendent for Public Instruction, and nonprofit organizations. They are esteemed for their high quality work, and we are very fortunate for their contributions to our community. And so it is now my pleasure, our pleasure, to introduce you to the Washington School Research Associates team, and they will be facilitating our conversation this evening. And to begin with, we'd like to welcome Dr. Dan Bishop, who will be here with us in person. We also have Dr. Robin Henriksen with us, coming in remotely, and Dr. Jorge Preciado. Welcome to the team, and we look forward to hearing from you, the voices of our community. Thank you.
Thank you so much. Thanks, Karen. And I really appreciate the opportunity to be here, be present with you, and with you, the virtual audience, to share with you the work that we've been doing in collaboration with you all, participants from the community. So with that in mind, we'll pull up the PowerPoint, I think, and get started with that. I'll use this as a way to cue my own thinking, but it'll also be part of the recording that you can use to remind yourself of some of the information that I was referencing. So let's get started here. So whether you are a parent or an interested member of the community, each of us has a vested interest in the children of the community and helping them to become healthy, caring adults. So thanks for being here. Thanks for being here present and in that virtual time here together. So as Dr. Mann said, Washington School Research, that's our connection. I'm Dan Bishop, Robin Henriksen, and Jorge Preciado are on the screen with us or on the call with us. And so they will be joining in at different times throughout the presentation. So let's get started. When we think about work like this, oftentimes we need to reflect on the goals that are involved and use those as a way to start the work, helping us to frame what we do, why we do it, and the outcomes that we're going to look for. So I've shared these up on the screen with you, and rather than read them out loud necessarily, I'll let them speak for themselves and give you a chance to kind of get a feel for what it is we're trying to accomplish here. So when you think about the words you see here, the idea of implementing a systematic, structured process to gather and analyze data, that process is the work that we've undertaken with the help of you all, the folks from this community who've provided insights into the very nature of what it means to support children and the families that are raising them. So, at the risk of giving away the story, I'm going to skip right to the findings, and then I'm going to encourage you to stay with us because that's where the real fun is getting to the findings. But as you'll see on the screen, there are two areas that we're looking at here. One area is related to the needs that families have to support children. And generally, those coalesce around three areas: childcare, the physical needs like shelter, clothing, food, medical care, things like that, and the social emotional needs. The other part of the findings that was interesting for us has to do with what we would call the access of resources and support structures. That is the ability for families to get the kinds of support they need, and the availability. So are those resources available in the area where they live or nearby such that they can access them? So that frames the findings here, and we'll dig deeper into one, how we got there, and two, some of the interesting details associated with it. So there were 5 project goals that we worked from. We wanted to know, go through and figure out the whole process, as we said. And so we looked at this from the perspective of how could we share with you what we did, why we did it, who was involved, how did we do it, and what did we find? So we developed a process that can be called let me switch the slide here. It was a nested research approach. And with that in mind, what we look at is this idea that there are layers of our work that are, one's embedded in the next is embedded in the next. So we took a strategic development approach to the process, identified the human resources and the need that were needed to implement the work, the research work that we did. Then we refined and focused our work towards deeper insight into the families and their needs, the clients in the district. And then we took a comprehensive analysis of the data, an approach to do that, to understand what resources were available and how they could be effectively used or utilized. So In a nutshell, that's what we were after. To design and implement that systematic, structured process for gathering and analyzing the data from representatives, individuals, and groups of people from the Granite Falls community. You all. And so I want to thank you again for your contribution to the work, because we would have nothing if it weren't for your voice in this process. So part of what we wanted to find out, who are the families that are currently being served? Who is still in need of support? What services are currently being accessed? What services are still needed? Where are families accessing these services? And where are they still needed? At this point, Dr. Hendrickson is going to share with you a little bit of the process and why we did what we did. Dr. Hendrickson?
Thank you. So as Dr. Bishop just indicated, the three main areas that we looked at were what were the current resources available to address family needs? What are the family needs? So what were current resources that were being accessed, but then what were resources that families would like to access but couldn't, and then why couldn't they access them? And then also, again, what were the strengths and challenges associated with trying to access those resources, as well as understanding what the families, some families indicated that they weren't even sure what resources were available that they could access. So part of it was education. So go ahead to the next slide. Okay, so I'm going to talk through a little bit of the process for our project. It was basically 3 phases, but the second phase and third phase are what I'm going to focus on, because those really were the data gathering elements. But I wanted to talk a little bit about the first phase, because we couldn't have done it without our organizations and our ambassadors. So I wanted to talk a little bit about that first. So Jana, at the very beginning of our presentation, listed a whole bunch of organizations that really supported the work that we did in terms of survey distribution. So first, what we were able to do was survey and make connections with a variety of organizations within Granite Falls that could then recruit survey ambassadors. And our survey ambassadors were trained and were our sort of feet on the ground in terms of taking tablets with the surveys that we created on them and working one-on-one with families within different organizations. And the organizations could have been, Boys and Girls Club, our early childhood education centers, a food bank, just walking through the downtown area and asking families to participate in the survey. What they also did was, as we were creating the survey, the creation of the survey was a very iterative process. So based on our initial goals, we drafted a survey, but then we really worked collaboratively to refine the survey questions. Our survey ambassadors helped us to also take the survey and provide feedback, so that when we finalized it, it had gone through many iterations in order to make sure it was really meeting the goals of the project. So then we launched the survey, and it went out via email throughout the school district, but also our survey ambassadors, like I said, had also scheduled time that they could really connect with families throughout Granite Falls and the different organizations that supported this work. So once we had finished sending out the surveys and collecting the information, we had about 475 total responses, which to me was a significant number of responses. We had a lot of families responding, which was really exciting. So then I will talk about the data in a minute, but then what we did was, from the initial survey responses, we looked at the data, and from there developed further questions that then we we asked some of the members who took the original survey if they were interested in participating in a one-on-one or small group, focus groups that allowed us to dig even deeper into some of the information that we collected. So for example, and I don't need to jump ahead a little bit, but if for example, we noticed that transportation was an issue, we were able to then say, tell me more about that. Why was transportation an issue? How could that be a barrier? Or tell me more about how location was a challenge. So we were able to really dig deeper into the why of the quantitative data that we learned about. So go ahead to the next slide. Okay, so of approximately 475 responses, we had 15 that indicated that their primary language was Spanish, 4 that indicated their primary language was Russian, and 456 that indicated their primary language in the home was English. The breakdown of race ethnicity was primarily white, Caucasian, Hispanic was the second greatest number, but we had approximately 20 different races, ethnicities represented on our survey. So that was really neat. And then the highest frequency of the number of family members living in a household was between 3 to 5, but we had a range of number of people living in a household anywhere from 2 to 11. Okay, go ahead. Okay, so what did we find? And I'll dig into each of these points a little bit more in depth. The first strength really that was pervasive was that survey participants, both within the initial survey of the survey instrument, but also within the small groups, was that they expressed a strong sense of affiliation with the Granite Falls community. They felt a connection and a sense of community. And then the next thing that we found was that there were significant needs for childcare and basic needs and social emotional support. And then finally, there were challenges with being able to access services and then the lack of availability of services. Okay, and here was some quotes that we pulled from our focus groups. So going back to that strong sense of a community affiliation, that first point on the previous slide, one respondent said that the community looks out for one another and they care for one another. If you ask, community members will help. People feel safe in Granite Falls and feel a sense of belonging. A few, more than one, so there's quite a few that said the Boys and Girls Club was also a wonderful resource for the community. They support a lot of families, as well as the library being a massive resource for the community. So we can definitely see that there are a lot of a strong sense of support from the organizations within the community. Okay, so then let's take a look at some of the challenges. So first of all, one of the main challenges that we started with the survey was asking about childcare. So that was the beginning of the survey. After asking about demographic information that I had already shared, we asked about childcare. So who were the primary childcare providers, what different options were being used, and then what were some challenges associated with accessing childcare. We also asked about what were some resources that were being used, such as food, housing, healthcare, as well as different social emotional support resources that were available that families were accessing, such as mental health, substance abuse, as well as that sort of proactive, what are some activities that are available in order to make sure that that the families and children of the families and community have activities available to them. Okay, so here are the results. So in terms of childcare, we asked what were the primary, or what were the different childcare options available? What did you access in terms of childcare? And we saw that 60, so the majority accessed a childcare facility. That was their primary source of childcare, was a facility. The next greatest frequency was extended family. And then the third greatest was a combination of both. So families indicated that they utilized both a childcare facility as well as extended family. And then you can kind of see the other available options that families indicated that they used, including neighbors, friends, older siblings. And then after the nanny babysitter, you can kind of see that there is sort of a mix or a piecemealing together of different childcare options. But definitely the childcare facility and extended family were the two main methods of childcare. And then we also wanted to ask, because this is such a strange time, what had you been using pre-COVID and during COVID? But we also wanted to forward into next year, recognizing that most likely, school will be back full time, and we wanted to be able to get a sense of what do you anticipate you using, knowing that right now and maybe a couple of years ago might look a little bit different. And so we wanted to make sure that we had covered both the pre-COVID as well as post-COVID, and they were pretty similar. So childcare facility, again, is what most families indicated they will most likely use next year once school resumes its normal routine. Families also indicated that older siblings and extended family were among the top methods of childcare. So pretty similar to pre-COVID and then this time over the past couple of years. So then we also asked about what were some challenges accessing childcare. So if you weren't able to access childcare, why not? Or even if you were able to, what were still some challenges associated with that? And again, as you can see, financial reasons were the biggest challenge, as well as location and the ages of the children. So location in terms of not being near their work or where they live, and then transportation, trying to drop their children off, just in terms of the time it takes to get to the childcare facility and then to wherever they might be working was just really challenging. And then another significant area were the ages of children, which is not necessarily uncommon in terms of, babies. Birth to 2 always is more of a challenge. And that was also reinforced in our data as well, is younger children, it's a lot more difficult to find childcare services. It's easier to find childcare for school-age children. It's a lot more of a challenge to find childcare for infant, toddler age. And then again, transportation. So not having transportation in order to be able to take children to a childcare facility or another method. And then there were a couple that of responses that indicated that a lot of the childcare facilities in Granite Falls were full. And I think that also links back to the inability, the ages of the children. So when you have younger children birth to 2, there's a cap on the number of children, obviously, that you can have in a childcare facility. So they were all full. And as well as with COVID, there was limited capacity. And so that was also a challenge, just not like physically not being able to have as many children in a childcare facility as before. Okay. So along with childcare, we also asked what were other services that were currently being accessed. And so the most frequently selected services were counseling services, financial support, food and living support, as well as medical services. And then there was a second batch that was pretty close in terms of frequency to the most frequently used, which was social support, learning assistance, employment support, and transportation services. Okay, and so also we asked, what were some needs that that you would like that maybe you are not able to access? So what do you view as some of the needs that you would like? So one of the needs that rose to the top, which was affordable housing. And that links to the previous slide around just basic needs and financial needs. So that clearly is a connection there. And then the next one is healthcare options that are close by. So while there might be social services, substance abuse counselors, mental health counseling, and family support, again, there are limited resources in Granite Falls. But the problem was that they were too far away. So the ones in Granite Falls were sort of at capacity. So families needed to drive 20, 30, 40 minutes to access those. But then if you see that transportation is an issue also, they're not able to access the healthcare options that are available to them. And so those kind of link together, the transportation as well as the healthcare options. They're kind of parallel in terms of being able to access the services. Without transportation, they're not able to access the services. And then there were many responses to the one on the second one on the right, communication information regarding available resources and how to access them. We noticed repeatedly that people said that they don't know what resources are available. So having communication and a better understanding of what resources they can access, I think would be really helpful. And then the final one on the bottom left was we had a great opportunity to have a focus group with non-English speaking families, as well as the survey data from the initial survey, talked about the need for having it goes back to that communication aspect of having an advocate or a liaison that can really make sure that our families that are moving in that might not be native English speakers feel a sense of community and the need that they would like to be involved, for example, with their children in their schools. But our school system is set up in a different way than perhaps they might be used to. So having a point person or a liaison that can really help mentor families that are new to the community, because there's a strong desire to want to be involved and want to be part of the community, but being able to access that is a challenge. And so it was really neat to hear that there is a sense of community by all members. However, how do we continue to engage a more active involvement by having sort of an advocate or liaison for our non-native English speaking families? And again, that last bullet on the right, I think reinforces that. So it's not just non-native English speaking, it's a lot of community members just like to know, what are those community resources that are available and how maybe there can be these advocates that would help support those communications. Okay, so now I'm going to turn it back to Dr. Bishop, but before he takes over the slide, I just wanted to really just kind of reiterate the appreciation of all of our families that took this survey, including our families who participated in the one-on-one and focus groups. I just felt such a sense of our families just really wanting to be involved, and their willingness to participate in this process just made our data so much more informative and helpful in really sharing and sort of thinking forward to these next steps. So Dr. Bishop, go ahead and you can take it from here. Thank you.
Thanks, Dr. Anderson. So before I go on to this slide, I also want to come back to a couple of key points that are factors that are actually impacting each other. So, for example, the idea of affordable housing. If affordable housing is really more affordable someplace further out of the city, then the challenge of transportation to get to where childcare is most prevalent in the city is a challenge. Or the communication from further out into where and how to access other kinds of resources and support. Those factors begin to commingle and have a multiplied impact on the needs and the ability of families to get what they need to support their children. So with that in mind, as we go through, you can begin to see how this idea of communication, so how do families get information about where to go to get resources and support? Where do they get information about childcare availability, the cost that's involved, and the transportation impact? All of those things begin to kind of play into some of the things that that come up now for us to consider. So there were, in our interviews and in the data, we had enthusiastic support for some kind of an early childhood learning center. Ideas that came from our community members were things like, well, there could be a clothing bank, or there could be some place where there could be help for infant child needs, these kinds of things. Places for families to develop friendships and mutual support. Then the communication structure. Where do families go when they have emergencies, but they're not 911 emergencies? Who are they called? How do they get to where they need to go or get help for picking up their child when they're late getting home from work because they're working outside of the Granite Falls community? Those kinds of challenges. One of the strengths of the community, as you've already heard, is this idea of willing help and support. So from that perspective, you begin to get a sense for where people can go if they ask their neighbors, for example, and others in the community. Then there's that communication structure that Robin has spoken to as well. But it also coalesces around this idea of remote areas and communication to those families, from those families, and their ability to communicate with each other as neighbors. So if they're distant, they don't really maybe know their neighbors, how do we develop that kind of connection? So part of the recommendation here is this idea that there'd be a system of support that brings people in and kind of wraps around them in really a powerful way. That it's coordinated, likely would have supports in different places, would be linked towards common goals of supporting families and the flourishing of children. Key considerations here, as you'll see, whoops, I didn't advance this screen. There we go. Key considerations would be, though, network of locations. Early childhood is a key thing here, too. It's harder to find supports for children in those birth to 3 or birth to 5 even, as compared to things once children get to school, there are some additional kinds of supports that come in through the schools. But some sort of geographic centers that could help students, help children and families to access the kind of supports they need. These are suggestions, by the way, that came from community members. Vans to address the transportation. If the bus comes once a day or twice a day, you have to spend all day going into town to get to the doctor or whatever. Are there some other kinds of transportation that could be more localized? And then this idea of coordinated communication, family home language, know and understand that. Schools have liaisons, support understanding, engagement, but to be intentional about that work. How do we engage families? How do we support communication that isn't just pushing out, but actually interactive and supportive? So looking forward, here are some things that we recommend you consider. Consider the current structures of resources that are already here. Granite Falls, as you've already heard, is a welcoming community, has strong affiliation of people who live here for the community. And the Granite Falls schools, the school district, the community coalition, Boys and Girls Club, the list goes on. Those are all strong elements that suggest there is a strong current structure that can really be a jumping off place for the work. The key would be to facilitate and support that effective communication that helps to link families' need to the resources that are available and their location. Consider strategies to support transportation, to support the family's access across the community to the resources. Identify and develop comprehensive lists of organizations throughout the community that provide family resources. And then conduct really a feasibility study associated with this idea of developing early learning centers or an early learning center with sort of tentacle outreach to other to geographic areas in the community. What this really boils down to, though, is that, and I'll frame these in two questions. How will, to accomplish this, how will you facilitate a shared vision for an integrated network of support that will do two things? One, ensures every organization that supports families, that provides resources, supports families in need, and that they have an important role in accomplishing that work of supporting families. And two, is the idea that this network would support, require the creation and support structures, in essence, an ethos, where every organization has a clear sense of what they do, how they contribute, and how they do that to support the greater good of the community. So with a quick look, you'll want to know that these are the organizations that are already here, that are already supporting this work, that have been doing the work, and we have the privilege of sharing that out with you. So with that, I think I'm done with my presentation, but we may have some questions either from the audience or online. Dr. Mans and Janet, do you want to
Yes,
facilitate with me?
absolutely.
Okay.
We'll check the chat and then also check with the audience here with us.
Okay.
To begin with, any questions from the audience here with us this evening?
So this is going to be a bit of a nitty-gritty question, but when you're talking in your data about social supports, what does that look like? Can you say more about social supports?
Social support. Data around social emotional support.
I don't know which slide I could.
I can answer that, I think.
Was talking, that might help.
Yeah, go ahead, Robin.
Thank you.
I'll pull up that slide too.
My internet's a little bit unstable, but when we wrote that question, it was specifically around options like MOPS, other parent groups, those more informal, but there might also be some formal parenting groups, just anything like that, maybe through church organizations or other, but really we envisioned it more around just those opportunities for parents to get together, or families to get together and I think like MOPS, mothers or preschoolers, kind of comes to mind. But that was an interesting question because that we recognized going in and adding that question, it could be interpreted in a couple of different ways, but that's why we made sure that we had social emotional counseling, mental health as a separate question, in order to make sure that we were able to also see how many participants were selecting social in terms of these other options for kind of getting together informally.
It's a really important distinction. I'm glad to see you put that in there, that recognizing that those social connections are capacity building for families, really.
Thank you. Yeah.
Not being alone.
And it came out in the interviews as well that voluntarily, obviously, they had done the survey, but they spoke to the need for this sense of connection with other families, with families of children their age. And so imagine if you have a 2-year-old, and so they're not in school, there isn't a connection with school yet. Where do they go as a parent to make those connections with other parents, but also engage their children in other kinds of social connections as well? So those are the kinds of things that came up that also created this enthusiasm around an early childhood center, yes, if children go to daycare, they get that. But where do the parents go to connect, or maybe after daycare or pickup or other kinds of things like that? So
Awesome.
thanks for asking that question.
We also had a comment from a community member, which was great, referencing some good work that's been happening over the years. The Granite Falls Resource Directory pulled together a number of organizations and resources for families. And so that certainly is a part of identifying what's available and then looking for ways to communicate and message that and help families to be aware of those resources. So thank you to that community member for bringing that point here to this evening.
Absolutely, that's great to know, because that is exactly the kind of thing that's a good starting place and or an effective leverage point for the community to go forward. Thank you.
Any other last
Were there
questions?
other questions that came up? Other questions from the audience? Great.
Thank you to Washington School Research Associates for your excellent presentation, Dr. Henderson and Dan. Dan, buddies now.
As anybody who knows me knows that I much prefer Dan rather than
Dr. Bishop.
So,
Thank you again to everyone who joined us for this presentation, whether you were online with us or in person. This project is all about listening to the voices of our families and then building the solutions that will help each of you to best support your children's success. We look forward to serving you by working on identifying possible solutions and then presenting those to you for your review and to shape plans. Once our community develops a clear plan, then we will conduct a feasibility study. Our goal is to bring to life the dreams of our families and community. With your partnership, we will be able to do so. Our contact information is available online, and we've emailed it out to many of you, but you can always put in the comments there if you need us to put it in the chat. And we will also send a thank you to each of you who participated in the call with that information, so you are able to reach us to ask questions, offer solutions, and to get more involved. We appreciate all of you very much. Have a great evening, and we will be in touch. Thank you. Yay.